Central.
All right, welcome back, everyone. Well, compartment syndrome is a chronic muscle condition that affects hundreds of people every day, especially athletes. The Wyoming Medical Center is home to an exclusive medical procedure to treat compartment syndrome, and I was in the hospital to give you all the details. Let's take a look.
5 years ago, I was a college athlete and doing everything I wanted to do, and started having pain in my legs when I was running, and they said I had compartment syndrome.
Compartment syndrome is when there is increased pressure in a muscle compartment.
The main problem is enlargement of the muscles in the calf. They push on the blood vessel, and after they push on the blood vessel, they block that flow while they're exercising. They block the outflow from the muscle. From that, they create a pressure difference, and then the muscle swells up, and that's when the patient starts feeling the pain.
It's a deep burning pain with any minor exertion, anything that I'm using my muscle for, flexing my feet, walking upstairs, running, jumping, squatting. And the way they treated it was through surgeries, so I had 3 on each leg for compartment syndrome, but after each one I never had any relief.
After undergoing 3 invasive surgeries, Lauren researched Dr. McGinley's new procedure on treating her compressed muscles through Botox. The treatment takes a different approach to fixing the issue.
With our treatment, what it does is basically it blocks that muscle that's deep in the calf that's pressing on the vein. So we're not actually treating the symptomatic muscle, the one that's actually hurting. We're treating the one inside that's causing the problem. So we're using a very low dose of Botox and treating a very small area of muscle to prevent that from compressing on the vein.
McGinley says this new treatment won't have any further complications since it uses small needles and doesn't cause any scar tissue. The procedure has treated up to 50 patients from around the U.S. and is currently patent pending. But in October, McGinley is planning to offer training to other physicians around the world.
Beginning in October, we're going to be training other physicians around the country to do it, but only doing it after they've been through a certification process, so they learn exactly how to do this step by step, so there's no variation. So if this is done in Philadelphia or San Francisco, it's exactly the same way I'm doing it here.
Dr. McGinley and various patients, including Lauren, are optimistic of the positive results the procedure has demonstrated.
So I'm very open, hopeful, cautiously optimistic.
Brittany Moore, K2 News. Well, it was certainly an inspiring story, and we have Dr. McGinley here in the studio this morning with us to talk to us a little bit about the story. How are you doing?
Doing well. Good morning, Brittany.
Good morning. Well, you know, one thing I wasn't able to put in the story there was how you got started with this and why this came about.
Sure. Well, that's a great story. I mean, this is why you go into medicine. I was here in Casper. I was in Casper probably for about a year and a half. And I was given some lectures, some educational lectures, and an individual in the crowd came up to me after the lecture and said, "My daughter's playing sports with this girl who has symptoms similar to what you're talking about. Would you mind seeing her? She's scheduled for surgery for compartment syndrome." This girl was Laura Stamp, a very high-level high school athlete here in town. That's really where the story began. She came in, was set up for surgery down in Colorado about a month later, and that's where this process started.
Oh, that's awesome. And you know, I know you were talking a little bit about your engineering background and kind of how that came about too. Correct. With discovering the treatment.
Correct. So when Laura came in, when we were working her up, we were looking for something completely different. And when we scanned her, we looked at her blood vessels. And by looking at her blood vessels, I applied engineering concepts that I use every day in medicine to problem solve. And it just didn't fit when I looked at the images, when I talked to Laura, when I evaluated her. So that's really where you get that integration of science and medicine really at the front line and treating patients and applying what you've learned over the years. And we were able to do that to direct Laura in a different direction and eventually save her from a pretty invasive surgery.
Oh, that's wonderful. And I know that's kind of the goal of this surgery, was to really make sure you don't have that much invasive scar tissue consequences with the surgeries.
That's exactly right. These surgeries, when they go well, it's great. The patients feel better. They get back out there and play sports. But in a lot of patients, scar tissues form after these surgeries. They're fairly invasive. And once scar tissue forms, that can be a lifelong battle in a lot of these individuals. They're all very young, most of them in their teens, and have to deal with that the rest of your life. That can be quite debilitating.
Absolutely. And all we're dealing with here is the small needles that you saw.
That's correct. That's exactly right.
All right. Well, thank you so much, Dr. McGinley, for being with us this morning. And for more information on the procedure, you can call the Wyoming Medical Center. We'll be right back after this break.